The guidelines for Australian GPs have been influenced by the NICE guidelines from the UK. They encourage pre-treatment, preferably early recognition in a primary care setting, followed by referral to an appropriate service for assessment and diagnosis, and then further referral for treatment, which I'll discuss in a moment, and also includes the need for aftercare. The most effective treatment for BPD is psychological therapy. SANE Australia identifies the three major therapies as dialectical behavioural therapy, mentalisation-based therapy, and transference-focused therapy. All three have been designed specifically for BPD. DBT aims to develop skills that the person lacks, such as mindfulness, interpersonal skills, emotional regulation, and distress tolerance. MBT works to improve the understanding of one's own and others' mental states, hence also improving understanding of behaviours. Transference-focused therapy assumes that the person lacks a coherent sense of identity, and treatment aims to teach people to identify and verbalise intense feelings rather than act out as a result of them. Medications are not a primary treatment for BPD, but they are used to manage specific symptoms such as emotional dysregulation and impulsivity. Examples include mood stabilisers such as sodium valproate, which has a sodium blocking effect plus a GABA enhancement function, leading to a stabilisation of the underlying irregular firing of neurons that contributes to the mood instability. Second-generation antipsychotics are used to treat impulsivity. For instance, aripiprazole. The mechanism of its action is poorly understood, but it's thought that the net result is a rebalancing of dopamine and serotonin, improving mood, thinking and behaviour. Meds must be used with caution, as negative side effects can exacerbate emotional dysregulation. Hospitalisation is not recommended. It should only be used if there is a risk of the person harming themselves or others. It's very important that care and treatment is done in partnership with the nurse and client as equal partners. The nurse's role is to ensure collaboration, maintain clear boundaries, and ensure that care is tailored to the patient. Many of these patients have experienced trauma, so trauma-informed care is essential. Manifestations of this disorder change across the lifespan, so the approach needs to change over time. As in many scenarios, it is the nurse's job to identify other members of the MDT and refer as necessary. Risk assessments are an essential part of ongoing care due to the high risk of self-harm and suicide, as well as substance abuse. Clinicians need to support themselves, for instance, by joining a consultation team if DBT therapy is used. The client needs to be an active participant for care to be effective. They need to turn up to therapy and do their homework. Mindfulness practice is especially important due to its significant impact on, for instance, stability of relationships, mood stability, and self-harm, as shown in the graph.